Hey there, Gen Mex. How are you doing? I'm excited to be here with Ron Elledge. You've seen Ron before on the channel. This might be the first time that he's at a live event, but he's been on the channel before talking about Medicare in other countries, Medicare Advantage specifically, or there are some supplement plans depending on what your situation is. So, Ron, why don't you go ahead and introduce yourself and tell us where you're coming from and yeah, what is your expertise?
Okay. Yeah, my name is Ron Elledge. I'm actually in New Mexico right now, and wish I was in Mexico instead of new, but you know that's the way it goes. I've been working with Medicare and been a Medicare representative for about 17 years now. About 7 years ago, because of the travel that my wife and I do, so much international travel, I really dug down and looked into the coverages and how Medicare works overseas. And at that time, nobody understood it. Nobody could explain it to you. And so International Living had me write a book, Medicare Made Easy, What Expats, Frequent Travelers, and You Need to Know. And that book is still on their website, and it's still one of their best sellers. And it's still a subject that isn't broached by too many. However, it's becoming popular. And so it's my forte. I love it. I work with people all over the world now, and it's just enjoyable to talk about the countries they're in.
Great. Well, thank you, Ron, and thank you, Gabe. You're the first one to comment. So everyone else, if you're here, introduce yourself in the comments. Tell us where you're coming from. And I do want to comment for Ron, though, that you wrote a book, and Medicare changes a lot. And that's what we're here for today, is the kind of the 2025 version, I guess, of what is it going to be? What changes are on the horizon for those of us who are over 65? What's different this year than it was last year? That's kind of going to be the focus today, what we're talking about. So, but to start out, I am not over 65, so I don't have a great grasp of Medicare. So let's get, kind of the A, B, C, D, E, however many letters there are. Maybe you could just go through those so we have a little bit of an understanding. And hey, Brian from Wilsonville, Oregon, I'm up here in Portland, Oregon, so not too far apart. But let's go ahead and go through the alphabet, Ron.
Okay. Yeah. First of all, Part A and Part B, those are the two of those are original Medicare. They're still considered that. They're the only two parts of Medicare that are actually run by the government. They oversee everything else, but these are government programs. Part A is the hospital insurance, and that covers inpatient hospital stays, skilled nursing care, hospice care, and home health care. Then we have Part B, and that's called medical insurance. And Part B covers doctor visits, inpatient care, home health care, durable medical equipment, and many preventative services. And the A and B, being original Medicare, they are run by the government. Now, Part D covers most outpatient prescription drugs because original Medicare has no coverage for prescriptions. It includes brand name and generic drugs. And these plans are offered as a standalone for people that are on just Medicare A and B, or maybe with a supplement, or if they're in an Advantage plan. And they're all offered by private carriers, private insurance companies. Part C then is the one that a lot of people are becoming more and more familiar with. In fact, it makes up 54% of of people on Medicare now, and that's the Advantage plans. And the Advantage plans combine the services of A and B, mandated by government to cover everything that A and B covers. And then they also cover Part D in most cases. Now you can, like somebody that has coverage from the VA or TRICARE, they may opt to get one that does not have a drug coverage in it because they have what is called creditable drug coverage that they can keep. But all of these Part C plans, the Advantage plans, are also offered by private carriers. And so those are actually the parts. And then they haven't really given it a letter, but then there is the supplement. So if you're just on A and B, you can supplement that with a supplement plan, Medicare supplement or Medigap plan. And those are also sold by all by insurance carriers, private carriers. And they usually pick up then the co-pays and the leftovers from Medicare original A and B. There you have it, my friend. You're ready to sign up.
Okay, let's see. So A and B, government run completely. But you can go to doctors in the private world. They take original Medicare. C and D are private plans, and supplements, same thing. Those are not offered by the government, but they're regulated by the government. So
correct. They're all regulated and approved by the government.
Okay, great. So, and I guess paid for partially by the government.
Oh yeah, in fact, hugely.
Yeah. Okay. So there we go. So let's see who's here real quick. So we've got Suzanne from Denver and also Bucerius. Very nice. I love part-timers, and also a broker for Medicare insurance. Debbie from Tacoma, Washington. Hey, Debbie. I've got Nancy from Washington State, and she is on Medicare Advantage. She's on a plan there. So, and I want to actually go into a little bit that there is this Medicare Advantage, and everyone start asking your questions now. So get those questions in there. I've got some questions that I have for Ron, but I really want to get as many questions as possible from all of you. And I'll be popping those up on the screen and asking Ron. But sometimes I hear Medicare Advantage. My cousin had that. It was really awful. So maybe you can explain a little bit about Medicare Advantage. We just said it's a private plan. So it's not offered. It's not a US government like Part A is Part A, offered by the federal government of the United States. And there's not like little splinters of that or something like that, or flavors or whatnot. But Medicare Advantage now is very different, it sounds like.
Yeah, Medicare Advantage is, I mean, there are many carriers, there's many plans. I mean, the last fellow I was with today was in a small area in California, and there was 44 plans available to him there. I think there was by 11 different carriers. And so it's, and they're very specific. They change from year to year. They have copays that can change. However, I will tell you, 94% of the people that are on them have an absolutely 180-degree idea of whether they're good or bad than your friend does, because that's what the percentage of people that are in favor of their plan that is an advantage plan say. It's almost an even tie between that and supplement plans. And so now, if it was 15 years ago, they were shoddy, they were rough, but boy, have they honed them down nowadays. So I guess does that answer your question?
Yeah, essentially. So my cousin in Wisconsin is going to have totally different providers, totally different options. It's not like, I guess it's probably like the marketplace for Obamacare, where you go online and you say, well, I'm in this zip code, and it says, okay, well, these are your options. And then if someone types in a different zip code, they're going to get different options. So
absolutely,
the options
they go by zip codes and states, but mainly zip codes.
Okay, great. So let's dig into the changes that are coming, because I've heard there's changes coming to Medicare. So for 2025, what's new?
Everybody has been afraid of this. In fact, for the last 7 or 8 years, every year, I hear people talking up to the annual enrollment period, which, by the way, we start in 13 days now. The 15th of October through the 7th of December is the annual enrollment period. We're in pre-enrollment now. As of yesterday, I could start talking about the plans for the first time. But there are changes, and they're always saying they're going to go to pot next year. Well, this year it looked like it. This year there were so many changes going on. For one thing, Medicare funding is looking at a 3-year phase-in of cuts that's going to begin in 2025. The final rule will see CMS payments to carriers reduced. You add to that the IRA, which in this case it's the Inflation Reduction Act. They're projecting a deficit reduction of $237 billion in the next 10 years. 73% or 173 billion of that is coming out of healthcare. And we understand the trickle-down effect. You know, that doesn't stay with the carriers. That ends, the buck stops at the consumer. Well, then put on top of that, there's a structural change in the prescription drug plan, the PDP, for this year. And it doesn't matter whether you're on a standalone or whether you've got it wrapped into an Advantage plan, the changes are the same. They have recalculated the TRUP, or the true out-of-pocket costs for the consumer's drugs. Last year, you could pay up to $5,030 before you hit the maximum. Then you went from there into the what they called the donut hole, and you paid more money until you got to a figure that puts you into the catastrophic, where you paid no more. This next year, you're going to, when you hit $2,000 worth of all of your drugs put together that are Medicare covered, when your cost hits $2,000, you don't go to jail. You bypass the donut hole. You go straight to the catastrophic, and you pay no more for the rest of the year. Now, that is awesome for those people that are high dollar users of really expensive drugs, but it's going to have to be evened out by everybody else. See, once the individual reaches that, they go directly. What that's going to do is throw a tremendous cost of drugs into the final stage, and that's got to be paid for by somebody, because we're going to see the catastrophic is going to last longer, and there's going to be a lot more people that are going to get into it. And once they hit it, they pay nothing for it. Well, you add to that, CMS has decided that they're not even going to pay their share anymore. Last year in 2024, when you
CMS isn't going to, who's CMS?
Oh, I'm sorry.
That's
CMS,
okay.
that's the Department of Medicare and Medicaid Services.
Okay.
Thanks. So Medicare, how's that?
There we go.
So Medicare has decided they're going to shirk their responsibility. And last year, when you were in the catastrophic coverage, they paid 80% of it. This year, they're going to pay 20% of that. The carriers last year only paid 20% of it. This year, they're going to 65%. And the manufacturers who paid nothing last year are going to pick up the other 15%. And of course, once again, we know where the buck stops. It doesn't stop with the carrier. It doesn't stop with the manufacturer. It stops with moi and you. New for 2025 is going to be a prescription monthly payment plan. The way that's going to work is those people that are going to have high dollar over the year are going to be able to pay zero at the pharmacy. And then their carrier will go ahead and they'll be the ones that will bill them on a monthly basis, and it'll be spread over the year. And the carriers are going to reach out to those that will be involved in that. Of course, I say don't wait for them. If you're going to be a high user, get in touch with them and get involved in that if you want to. So what I can tell you is that the ANOC letter just hit a lot of people's mailboxes. I'll tell you what that is. The ANOC letter, or it's going to this first week in October. That's the annual notice of change that everybody gets for their previous year's plan. Usually that's a little fold over that we either file, we burn, we shred, or we just throw it away. This year, I say you need to look at it, because there are a lot of changes, and that spells them all out for your plan. It'll help you make a decision whether you're going to stay in it. Some carriers are pulling out of counties. They're pulling out of states. They're repositioning. My home state is New Mexico. We've lost 2 major carriers for 2025. I've got a lot of people that I've got to move into a different plan for next year. And these changes are probably going to price some people out of the Medicare supplement. And the reason for that is because it may price them out of their PDP, their drug plans. You got to realize the majority of this financial is going to hit in the drug portion of the plan. Well, a Medicare Advantage plan has that wrapped into all of their other services so they can spread it around. A PDP plan, a standalone plan, they get hit with it and they have no place to put it except either the carrier eats it or they send it to you and I just don't think they're going to eat too much of it. So lots of changes this year. And that's besides just the housekeeping. We're going to see our Part B premium go from 174.70 to a projected either 185 or 186 a month. That's not out yet. We can only get the projections. The Part B deductible was 140 this year. It's looking like it's going to go to about 157. And then the hospital co-payments and the skilled nursing, those are all, they increase every year, it seems like, or at least they go up and down every year. And the trajectory is up over the years.
Yeah, it's inflation. It's affecting the U.S. It's affecting Mexico. It's definitely, well, here Gabe has a comment here. This should not be this difficult. I think this is true. It's the way we've got things set up in the U.S. for healthcare is very oriented towards insurance companies and healthcare. And then, the complexity of doing those two things versus the government just handling it. You mentioned something like 94% of people like their Medicare Advantage plan. What's the number for original Medicare? Isn't it also very high?
Oh, no. Now, yeah, that's what I did say that. I said they're almost tied. They're both somewhere. They fluctuate by the study, and they both fluctuate between 94 and 96% satisfaction rate. So Medicare, I'll tell you, people that are on Medicare that know how to use Medicare are very happy with Medicare.
Okay, so here's another question here from Nancy. I don't understand that payment plan thing. I'm looking at that on page 24. I don't know if page 24 means something to you, Ron, or if that's in an Advantage plan. So it's probably different. Nancy's up in Washington State. So
Nancy, let me tell you how I, as a representative, as an agent or a broker, was told to present that. And that is, don't even bother talking about it because it's so convoluted. What really we need to look at is the fact that it's going to spread the payment of your drugs. Let's say you were going to reach $2,000, you knew it. It'll spread that out over the next 12 months so that you can just pay it monthly, and it'll be incrementally to where it'll be much lower. It'll be something that you can expect, and it'll be what you know, and there'll be no fluctuations like when you go from into the donut hole and then back out like there was last year. And so that's the way to explain it. Now, the reality is that carriers, it's their onus to explain that to their clients. And so I teach my clients to be sure that if you're in that high area, and I know it because I go over their drugs with them, and I tell them you're a person, you need to reach out to your carrier January 1st or 2nd, as soon as it starts. And you need to tell them that you need the information and you want to get signed up into the payment plan. So, that's about all the understanding I have of it, because I could go in and explain it, but I'm telling you, it's convoluted, just like everything else is. It was written by lawyers and government people, which are mostly.
Let's go back to Gabe's comment. It shouldn't be this difficult.
It is bizarre. I tell people, when you're aging into 65 and every year even, if you don't get help, you really better be a genius and have a lot of time that you want to spend on it. Otherwise, find somebody that knows it, can help you. People don't realize it, but there is never a fee and there is never an obligation for any services that I provide. And brokers are not allowed to charge a fee for their services, because if you go into a plan, we're compensated by that plan.
Again, what is your title? Is there like a group of people like you, like if someone's a broker or a advisor, or
and they go by a lot of names, but basically it's either an agent, probably an agent or a broker, or just a representative.
Okay.
But agent or broker.
Okay. So,
if somebody wants somebody that's local, I can reach out. I'm licensed in almost every state, but I can reach out and give them somebody in their state, help them find somebody in their state.
I don't have your email address on a lower third here, but so what is your email address real quick?
It's pretty difficult. It's ron@ronelledge.com.
Okay, and I spelled that right? Elledge.
If you didn't, I did.
Okay, there we go. Okay, cool. So people need to reach out to Ron. That's the contact information there. And
you're welcome to.
Okay, awesome. Thank you. And actually, this is a good spot. As you just took a drink, I'm going to take a drink, and I'm going to invite everyone else to take a drink, because this is a happy hour. And especially after all this confusion, we might all need a drink, alcoholic or not. But I'm here, and I am having a sombrero, which is Kahlua and milk. In this case, it's an oat milk, but I'm going to mix this guy up now. I've been waiting to get to the point where I could mix this up and actually taste the whole thing. And boy, that just doesn't mix very well, does it? They'll just get better as I go, I guess. Yep. Got these guys over in Guadalajara, by the way, little mixer things. So, and Ron, what are you drinking? And then I'm going to ask everyone else if you are participating in the happy hour.
I'm actually, I've got a little glass of Spanish Tempranillo.
Very nice. Cool. Great. So let's now, most folks here are going to be interested in Mexico. They better be learning their speak Spanish, but people talk about getting to Medicare age 65, and you can ignore it completely if you're living in Mexico, and just say, like, I'm not paying in at all. And you could get a supplement plan. You could get an Advantage plan. Maybe you can talk about the difference there, and if there's what not to do. And as you think about that, I'm going to see here. Nancy's got a beer. Gabe's got a red wine. And Jerry has maybe a question. So I'm going to pop this up here. You know what? I'm going to pop that up after you talk about supplement, Advantage, or part A and B. Can you just ignore it and not pay in at all and just say, hey, I'm in Mexico now?
Okay. Yeah. The first thing that you said, that is one thing that nobody wants to do, is ignore it. And the reason I say that is because in our lives, we may have plans that we are never coming back to the United States. But you know what I have found with so many clients, things change. Mm-hmm. And if you don't opt into Part B when you turn 65, and you don't have what is called creditable coverage, and that is only coverage that only classified as coverage that comes from an employer plan that you are actively working for still at the time, or if you're on a mission overseas for at least 12 months and it's with a company that is set up in the US to pay taxes and you're covered with them, then there is no other way that you can get around it. If you don't sign up, then you start accumulating a 10% penalty per year. And that's of that $187. So if you're gone 10 years, and you decide, hey, I'm going to move back to the US. I got sick. My mate died. These are all things that I've seen happen, and people have come back. When you come back, you're going to not owe the 186. You're going to owe that twice, and and it's a lifetime sentence. You're going to do it every month for the rest of your life. And so it's something to really watch. Besides that, when you come back and visit the US, you've got to be sure, if you don't have A and B, at least, that you get travel insurance to come to the US. And I can tell you, when you get older, that gets expensive and hard to get travel insurance to come to the US. You might be able to get it to go somewhere else, but not the US.
Yeah, I know a lot of travel insurance plans. I talked to someone about this. There was like, this was the price the price down here for like every country in the world except for the US. And if you wanted to include the US, you're going to be like way up here. So it's like everybody else, and then everybody else, including the US. So you got to watch that one.
And then when you get older, I mean, you hit 70 years old, even, it's almost impossible to get. And if you had any sickness in there or any problems in your life, pre-existing, you may as well just drink your wine and sit back on the couch, because you're not going to visit the States.
Mhm.
So be careful with that. That's something I tell people, that when you hit 65 during your window of opportunity, be sure and sign up for Part A and Part B. Unless you are that, you've either got work experience, or there is always that individual that is the high wage earner, and they're going to continue earning that for 2 or 3 years after 65, because our Part B is not 185 if we make over 200, if we make over 106,000 a year. It goes up from there, and it can go up to about about 600 and some dollars per year. I mean, per month now.
Okay.
And so if you're in that, it may make sense, but you got to be really careful when you explore that.
Okay. So let me see here. So A and B, you got to buy A and B no matter what, or B, I
Yep.
guess. Is A kind of like always there, and B is the one
Yep.
you pay for. And then on top of that, you can get a supplement plan or an advantage plan, or does this advantage plan kind of take care of A and B and get rid of
Yeah.
that?
Once you have A and B, you have to have A and B to be eligible for a supplement plan or an advantage plan. You have to have A or B. You have to be eligible for A or have B, one or the other, to get into a drug plan. It's a little easier. But so you have to have A and B to do the ancillary. So you either choose the supplement plan, and for that you're going to pay a premium monthly. Then you're going to pay a monthly premium. Usually, let's say you do a G plan. That's the one most people favor now that the F is not available. You do the G plan. It covers everything except the part B deductible each year, which was $240 this year. That means that no matter what happens, you pay your premium, and if it's covered by Medicare, your supplement picks up 100% of the rest of it, and you have no out of pocket. So, and the next thing about that is you can see any doctor that takes Medicare anywhere in the United States. And so that people that are traveling a lot in the United States, they see that as a big plus. I don't see that as a big plus anymore. And the reason for that is, you know what? If you are going to go out of the States traveling and you want to see a doctor, and you try to be a new patient to see a doctor in almost any place in the United States, you're going to have a 1 to 3 month wait before you can see them anyway. Well, if you're traveling, you're going to use either you're either going to use the emergency, or you're going to use urgent care, and that's covered everywhere in the world by your advantage plans also. So, either one of those, but you can see any doctor that takes Medicare. Your advantage plan narrows that down into networks. They're huge, but they are networks. Now, here's another reason that a person would not get an advantage plan. I do both.
That's good, because I was going to ask you this question at some point. I was going to ask, like, who should not get an advantage plan? Because we haven't really even talked about, I mean, we've been talking about all the changes and whatnot. We haven't even talked about why the advantage plan is something that you should be considering if you're living in Mexico, if you're a United States citizen living in Mexico. So let's back up to that.
I'll get to
before
that.
we get into who it doesn't work for. So who does, or why does an advantage plan, or why do some advantage plans, why is that advantageous for people living in Mexico?
Okay. First, let me answer the question the one I had my track with, and that is those who shouldn't get the supplement plan. And that's somebody that is really—
Wait, those who shouldn't get the supplement plan, or those who shouldn't get the advantage plan?
Those who should not get the advantage plan. They should get the supplement plan. I'm sorry.
Okay.
And that's somebody that when they turn 65, they are chronically ill. And by that, I mean, they have a mass of doctors. They are almost tethered to the house, or they're going to Mayo Clinic, and that's where their doctors are, or they're going to Scripps in the San Diego area, because those two entities do not accept advantage plans, but they will take your supplement plans. So there are reasons that I have people that I just tell them, I don't think the advantage plan would be a good fit for you. But I will tell you, those people that are like that, they're probably not going to be traveling to Mexico.
Hmm. Good to know. So
If they're going to Mexico, they're going down there because they're looking for they're looking for a nursing home down there to get that they can get into. And that happens a lot now.
yeah. And Jerry, I'm going to get to your question in a second, but let's talk about that. Why Medicare isn't so great, why original Medicare isn't so great for people who live in Mexico, why some supplement plans may be okay, and why Advantage plans might be the best bet.
Okay. First of all, if we were looking at A and B is an 80-20 plan. It's the third largest reason in the United States for bankruptcy because you're on the line for 20% of everything. But it also has no out-of-country coverage, except if you're traveling along the border and you have an accident and it's closer to be treated in Mexico or Canada than it is in the U.S., or you're coming from Alaska to right straight to the U.S. on a direct route and have issues in Canada, it'll cover you. Or if you're on a cruise ship that's in port in the United States or within 6 hours of a U.S. port. So those are, that kind of puts it out for any kind of travel. Mm-hmm. Now, both the Advantage plans and the supplement plans, or at least 6 out of the 10 supplement plans, there's 10 to pick from. So they're not all the same. But 6 out of the 10 plans have emergency, urgent, and ambulance worldwide coverage. So when I talk about worldwide coverage, I'm talking about urgent care, emergency care, and ambulance only. It's not, I'll go see the doctor tomorrow and use my plan. It's those 3 things when you're out of the country. And supplement plans, 6 out of the 10 of them, and many, in fact, nowadays, most of the Advantage plans have coverage for the worldwide, but it's very different. If you have a supplement, they're all the same for their coverage, all 6 of them. You pay a $250 yearly deductible. This is for worldwide, for your worldwide incidents. You pay 20% co-insurance for everything that Medicare covers. Your coverage has a limit of $50,000 per lifetime, and they're good for 60 days of each trip out of the country. So you have it, but it's expensive and it's short term. Now, let me just give you an example of where you can get into trouble with this. I have a gentleman that was in Mexico just, I think it was 5 months ago now, had a problem with an aortic aneurysm in his belly area. Had to have an emergency surgery on it. It was $74,000.
In Mexico.
In Mexico, $74,000. People think it's cheap. Well, yeah, it's $18 to go to the doctor, maybe, or $12. Mm. But boy, if you have a major issue, it's expensive in Mexico. It's expensive in Thailand. It's expensive anywhere. Mm-hmm. Not like the U.S. That probably would have been $250. But anyway, so let's say he was on a supplement plan. First of all, he pays the $250. Then he pays 20% of the first $50,000. So he pays $10,000. And then he pays, it was $74,000. He pays out of pocket 100% of the $74,000 because he reached his maximum lifetime under his supplement. So you're on the line for what is that? That's almost $50,000.
Mm-hmm. Yeah. So it's the 27 that's over the 50.
Yeah.
Once you reach that. Yeah. So yeah. And that's really what I think about is in Mexico, most things are inexpensive. Even I had someone who had to have brain surgery. It cost them $15,000. But I know someone who had to have long-term multiple surgeries after a car accident. And it was something over $130,000.
Yeah. They want to be paid, by the way.
Yeah. Yeah. So it is, it's one of those things where I think in Mexico, you're probably pretty safe paying out of pocket if you can afford something like a $10,000 unexpected expense, but you want something to cover those $100,000 expenses.
Exactly. And you know what? You're not going to get that out of the supplement plan for that reason. And the fact that you can only be in Mexico for 60 days. If he would have been 61 days, it wouldn't have paid anything.
Yeah. Okay. So let's talk Medicare Advantage now. What
the Advantage plan has a different. And the vast majority of them have worldwide coverage now. And again, that's urgent, that's emergency, and that's ambulance. They have a copay, the same copay as your emergency for the US. So if it's, and those vary anywhere from $90 to $135 normally. One carrier, a major carrier that a lot of people use if they're living in Mexico, they charge 90 to 110 depending on where you're at in the US. But if you're anywhere overseas, they charge nothing. So it's zero copay. Mm-hmm. Then you have no co-insurance at all. So instead of that 20%, there's no co-insurance. So your zero is what you pay, or your 125 is what you pay. Most plans, or many plans, have no limit on the coverage. Some of them are coming in now and they're limited it. I have seen it to 25,000 and 50,000. That's per year on them, not lifetime, but still, I don't write those plans for my clients normally that are spending a lot of time out of the country. It just doesn't make sense. But you've got to be able to go in and research the evidence of coverage and know where to look to be able to find that. And I could teach anybody to do that. But the ones I write, they have no limits on coverage either. So you're paying your copay and that's all. And they're good for up to 6 months per trip out of the country.
Okay.
So there's a huge difference. So I have people living in Mexico that are there most of the year, but they come back and see relatives and they see a doctor in the US twice a year. So they every 6 months, and it keeps their plan live. Now, I will add to that, you do have to have a U.S. residential address.
Okay. Great, because that's going to establish what zip code you get to choose,
absolutely
where you're going to do that. So, great. I think I understand that. Now, one of the things that I haven't talked about on my channel, which I'm hoping to cover, is IMSS, which is a Mexican health insurance, the kind of the nationalized health insurance, which is paid for by employers for employees, but foreigners can pay in, and I think it's about $1,000 a year or something like that. So that is another option for catastrophic care in Mexico that I have not covered yet, but I just want to kind of mention that. Of course, Medicare Advantage here, there's some definite advantages because you're going to be going into private hospitals probably with the Medicare Advantage plan, versus EAMS, you're going to use the EAMS public hospital.
Any hospital anywhere in the world.
Yeah.
Now, because there's a caveat with that, and that is you pay up front and get reimbursed from your carrier. And that's with the supplement, and that's with the Advantage plan, as it is with many of the travel insurances anymore.
Yeah. So that's something that person that had the $15,000 bill for the brain surgery, his wife had a $10,000 limit on her credit card. And so she was scrambling to get the last 5,000 because they wanted their money. Of course, she was going to get reimbursed. Actually, she didn't have insurance at all, but so she needed to pay, and they were wealthy enough to be able to afford it, but not like that. So be ready to pay those bills, have a plan, make sure your credit limits are high enough to deal with that.
Now, Brenton, there are several different agencies, there's a couple of different big medical groups, and there are a lot of hospitals in major cities in Mexico now that have arrangements with the carriers in the US so that they can do first dollar pay.
Yep.
That's really, it's coming. It's going to be slow, and I don't expect our government to get on board with it for a while, but it's coming from the healthcare side of it in Mexico and the US. They're kind of working together, and we're seeing some neat things happen.
Yeah, I think Lakeside Medical Group is one of those that I've visited, and in the Ajijic, Guadalajara area. I think they've been branching out into a couple other areas, but yeah,
essentially areas now.
Okay. Yeah. So they're floating that. So you don't have to pay that as long as, you're involved with it. So you're a member with them. So, okay. Jerry had a question earlier. I want to pop this in here. So turning 65 in December, expect to be full-time in Mazatlan. Aside from A and B, what other Medicare part is essential to sign up for now? So essential parts.
It's going to depend a little bit. This is a conversation I have with a lot of people because it's going to depend a little bit on how you're going to have your Medicare registered, how you're going to do your Social Security, how you're going to do your taxes. If you're moving everything to Mazatlan, your bank accounts, your addresses for all of that, then A and B is basically all you're going to have, because A and B is predicated. It's reliant on you being a citizen of the U.S. That's all. You don't have to have residency anywhere in the U.S. to have A and B Medicare. But when you get a supplement, it's now reliant upon the state that you live in when you enroll in it. And when you have a Medicare Advantage plan, it narrows it down even a little farther, and it gets into the zip code and the county and the state in which you're in when you do it. So if you're not keeping a residential address in the U.S., then A and B is what you're going to do. The cool thing is, when you come back to the U.S., even if you were to have all kinds of issues with you, you could come back on the 28th of a month, and you could sign up for a Medicare Advantage plan that would start the first of the next month, because there is never a question asked about health on an Advantage plan, and there are no pre-existing conditions. Supplement might be.
Go ahead.
Supplement might be different. After your window, let me explain the window, the period, and that is, it's called the. Can I just take a minute and explain?
Yep, that's what I was going to ask about. Is like, when do you sign up, and how does that work?
All right. First of all, the optimal time for Medicare itself, the A and the B, is when you're turning 65. It's during your IEP. Should I explain that? Of course. That's your initial enrollment period.
Oh, initial. Damn it, I was close. Yep. Okay. Initial enrollment period.
Have some more Kahlua, my friend.
Yeah, thank you.
Okay. Your IEP begins 3 months before you turn 65. It includes the month that you turn 65, and it ends 3 months after you turn 65. So it's a 7-month period. During that time, you could sign up for you sign up for Part A and B. And then you can also sign up for any Advantage plan, any supplement plan that you want to sign up for. And then supplement plans have their open enrollment for another 6 months after that. However, with a supplement plan, after you have gone beyond that 6 months, then you have to undergo underwriting in order to get in it. And that's you don't have to do blood draws and all of that. You just have to fill out 2 pages of very involved questions about your health, about your doctors, about your diseases. And it's up or down. It isn't how much you pay. With most plans, it's up or down. There's a couple of them that are written as group plans, and so you can still qualify for their plan, but it might go from $130 a month to $325 a month. So they're a little harder to get into if you don't get them and hold them from the very beginning. But when you come back to the U.S., you don't have an option to get into Part B when you come back to the U.S. That's not a reason. That's not a special enrollment period for A and B, but it is for Medicare supplement, and it is for Advantage plan. However, with the supplement, you'll undergo the enrollment process, and with the Advantage plan, it's just, don't pass go and go right straight to the plan. So let's hit one more thing that's a fun fact about. We're going to blow somebody's mind now that said this is all so confusing. Get this. Your IEP, initial enrollment period, covers that 7-month period, and it covers your A, B, and your Advantage plans. So if you miss your IEP for getting into Part B, you're going to have to wait until the general enrollment period. And the general enrollment period is January 1 through March 31st of every year, with coverage beginning the following month. So you have to wait. So let's say you turned in January, and in January was your birthday. So January 1st is actually your start date for Medicare. You can go 3 months past that to get into B. But if you didn't, then you decide, let's say May 1st, that you're going to go ahead and enroll in Part B. Guess what? You can't. You can't until GEP. And not only that, that's going to throw you a full year later, and you're going to owe a 10% penalty. So you got to be very careful. Now let's throw another caveat in that. And that is your IEP, once let's say you had an employer plan and you extended your Part B, or you didn't sign up with it, and now you're signing up during the general enrollment period. If you didn't start your Part B during your IEP, your Part B plan can start during the GEP, but you have got to be very careful with your Advantage plan because you no longer have the 3 months after your Part B. Now you're in what's called the ICEP, and that is the initial coverage enrollment period, and that states that you have to have your Part D drug or your Advantage plan start the same day your Part B starts. If you don't, you have to wait until the annual enrollment period for your Medicare Advantage plans, which is October 1st to December 7th, with coverage starting January 1st. How we doing, class?
Yeah. Okay, I'm lost.
Cheers.
I don't know if you guys are exactly. Yeah, I love how excited Ron gets about this stuff. But
It's nuts.
Yeah, I got a
It
lot of
all
it.
works if you understand it and
Yep.
you adhere to it. That's the issue. Is who tells you this? So
Yeah. So Suzanne is another person who works in the Medicare brokerage area, I guess. MD Anderson is something she mentioned, and that's probably when you were talking about scripts. And what's the other? Mayo. Is MD Anderson also in that list, maybe?
No, Mayo is actually going to be in, you're going to look at your Mayo. They're going to be in back east. They're going to be in Phoenix, and they're going to be in Florida, but Scripps is in Southern California.
Okay. So yeah, I'm not sure what MD, because this was a comment a bit ago. So I'm not sure what that comment was.
MDA Anderson, that's a cancer clinic, I believe.
Okay. So maybe.
And it does take some Advantage plans now.
Okay. So let's see here. So we've got Nurse Adrian. She's a private patient advocate. I love the idea of patient advocates.
That's awesome. I'm a Medicare advocate for people. I really am.
Cool. Yeah, very good. So let's see here. We've got Lisa. Oops, actually, no, we got this confusion is the reason retirees are offered an Advantage plan through a company. They just go with it. Oh, that's interesting. So you can get an Advantage plan through a company when you hit 65. Like, how does that work?
When you turn 65, a lot of people don't even know it, but their plan in their work is going to change to a Medicare plan, especially if their company has 100. Here we go again. No, if their company has 20 employers or more. If they have less than that, then it's a whole different ball game. Their company then can force them to go on Medicare and Medicare Advantage aside from the company. But if they're a larger company, they'll just leave them on their plan while they're working, but their plan at 65 will change to a Medicare plan, and they will at least use their Part A. It may not be an Advantage, it may be a hybrid, but they will use their Part A.
Interesting.
They can't force you to get to Part B if they're a large company, but a small company can.
Yeah. So this is what I tried to put up there. Lisa Wood says she'll be rewatching this and taking notes. So yes, this will be available as soon as we're done. This will be available again. So let's see here.
Can I go just a little farther on that? Because this is an area I've seen too many people get in trouble.
Yep.
And that is when you're working for a company, many times they will allow you to go ahead and stay on their plan after you have retired. If they don't require that to be a Medicare Advantage plan, or at least a Medicare based on A and you having B, and you just stay on their retirement plan, that is not creditable coverage by Medicare, which means if something was to happen with them, like, Delta a few years ago dumped it all, or it got so expensive that you couldn't afford it and you had to go back to Medicare, you'd owe penalties because you didn't have creditable coverage the whole time you were on that employer. COBRA is not creditable coverage. You've got to be careful with some of the things. Creditable coverage to be able to get a Part B special election is predicated on you being a working employee of that company.
Okay. So we just got a question mark here. I'm not sure if that was specifically about that, but as I understand what you just said is that you have to do that Part B stuff. You got to start paying into Part B, and there are ways to think that you're covered when you're not.
Oh yeah.
And yeah, so really
now if you're working and you're just going on working past 65, you don't have to get Part B. Okay. And that's real important for people to understand, because if you're covered by your employer's plan, there's no sense for you to pay $185 for the Part B. And then when you get ready to retire, about 3 months before you retire, you've got to get a letter. That letter has to be submitted to your company. They will fill it out saying that you had creditable coverage from this date until the date that you are retiring. Then when you make your application for Medicare Part B, you already have A because it's free. When you make it for Part B, then you go ahead and submit that letter with it, and then there's no penalties.
Okay, great.
And I have that letter. If anybody needs it, just email me. I'll send it off to them.
Of course, that's someone who's planning their retirement for at least 3 months. I'm a fan. Like my last job, I think I left. Yeah, if they got 2 weeks, it was lucky. So
they have after they either leave it or the company drops it when it ends. Either their employment ends or their coverage ends. They have 8 months.
Yep. Yes. Okay. Got it. So another thing from nurse, it's important to have a healthcare proxy and a medical power of attorney. In case you are incapacitated, not able to complete the application. So that's actually interesting. So having it before you're 65 to make sure you can make it through these applications and whatnot. Also, I'm going to be doing a video. I'm calling it Dying in Mexico. And it's going to be all about what does it take to die in Mexico? So really, so that your spouse probably isn't just overwhelmed by what it takes to die in Mexico. Because, if you're a foreigner and you die in Mexico and you're not in a hospital, you're going to get an autopsy. It's just the way it is. So things like that, the police are going to be called. So there's a lot to talk about, including the idea of a power of attorney and a medical power of attorney, healthcare proxy, things like that. That will be coming up. This one's been something that I've been working on for a year now. So some of these videos take a long time, and some of these videos are not such a long time. I think Ron emailed me about 2 weeks ago and said, hey, October, things are changing. We should do another video. And we got something scheduled within 2 weeks. Other things, it takes a little bit to kind of, I want to understand it first. So this
Let me
dying
give you a disclosure. I just looked over at our screen because I'm looking at a different one. And I saw my picture, and I want you to know I'm not a ghost and I'm not that pale. It's the lighting.
That you have a halo.
I thought, what the heck's wrong with me?
You have a halo too. So let's talk about that help aspect of getting someone to help you here, because we're getting near the end of the hour. So
oh, really?
It is personalized. How do folks like you, folks like Adrian, folks like Suzanne help folks?
Well, there's a couple. There's a couple ways you can, any Medicare. Here's the question that you ask if you talk to somebody that represents Medicare. And I'll guarantee you, anybody that's even getting close to 65 in the last 2 or 3 or 4 months before they turn 65, they've had 100 people that have come out of the woodwork wanting to serve them. One of the questions you've got to ask them is, how many of the plans in my area do you service? How many of the carriers? I tell people you never want to go and be serviced by somebody that is captive to Humana, to United Healthcare, to any carrier. And the reason for that is their plan is the best plan, whether it's the best one for you or not. because it's the only plan they can share with you. You need somebody that has a good grasp on the majority of the plans in your area, that has been doing it, I would say, for at least 2 to 5 years. Longer is great, but in 2 years you can get a pretty good grasp on this business. Get somebody that's a little bit seasoned, somebody that's a broker or works for a broker that has access to the plans that you might need. And then sit down and visit with them. Go on Zoom, talk to them. I do 90% of mine virtual. Now 90% is virtual by telephone or by Zoom. This industry completely changed COVID. Before that, I had to go out and see about 90% of my people. Now nobody wants to see me anyway. They just soon do it by phone and get it done.
So I have a question, in terms of that, doing things by Zoom. Do people have to be inside the United States to sign up for their plan, or can they just do this from Mexico?
You can actually do it from Mexico. It used to be that they said you could not, but nowadays there's so many things that have changed because so many people are living around the world that there's a lot of things that either slip under the radar but are really not illegal, but used to be kind of an unwritten regulation that are just not there anymore. I mean, you used to have to, if you had an Advantage plan, you had to be in your area, your zip code. You have to live in your area for 6 months of the year. Now you just can't be out of it over 6 months at a time.
Mm-hmm. So that's
the
really,
way they're all written. I mean, that's a big difference, and you interpret that completely different. And so, go ahead.
You have to come back to your zip code. So that's 6 months. You have to return to your zip code, not just to the United States.
Well, again, unwritten.
Yeah.
Most people, if you've got a plan, and many of the Advantage plans now will cover their doctors anywhere in the United States, even the HMOs. Any PPO will, but even the HMOs, they'll let you may have your zip code in Arizona and come back to Texas and see a doctor that's in network. You're in network.
Okay. And Jerry pointed out here something. Power of attorney in Mexico is much more restricted. They had their U.S. power of attorney apostilled. It was not accepted. And actually we signed power of attorneys in Mexico. So that's part of that video that's coming up is, you need a Mexican will, not your U.S. will. Looks like a U.S. power of attorney might not apply down in Mexico. And
vice versa too, Brighton. You will not sign up for Medicare and show me a power of attorney for Mexico and it be any good. You have to have it in the United States.
Yeah. Awesome. So Ron, we are at the top of the hour, and Gabe, who's been here since the beginning, says this is great information, ever changing. So yeah, we are in that time period now, or in 12 days, I think Ron said, when people can sign up for their new Medicare Advantage plan. Sounds like there's some other deadlines that are scattered throughout the year for other folks. So
one last idea there, and that is, if you're only on Medicare A and B, get off of it. I mean, get something else, get a supplement or Advantage, because you are on the brink of bankruptcy with one fall. However, if you're on just plain Medicare, or you are on a supplement and decide because of the travel you want to see about changing, you can only do that from October 15th to December 7th every year. That's the only time that you can opt into Advantage plan. You can change your Advantage plans again in January, from January 1st to March 31st. But if you don't have one, you can't get it any time of the year except the AEP.
Yep. Okay. And that's what we're about to be in. So hopefully you'll get some folks emailing Ron at ronelledge.com. You can sort them out maybe based on zip code. But I know you are super helpful. Everyone, I've always gotten great responses back that, hey, I reached out to Ron and he got me set up with a referral or with a plan. So, or with as you said earlier, this is not for you. Go with the supplement plan or something like that, because I think Ron's a straight shooter. If it's not right, he's not going to recommend it. So,
yeah, many times I just tell them what's in their plan they didn't know, and it's good. stay with it.
Yes, exactly. But everything changes every year. So it's always good to check in with whoever your Ron is. So so Debbie says that she has a broker, and that is great. Happy she does. We've got some thank yous here. So thank you guys all for being here. And if you don't want to change, you don't have to do anything. So your plan might have changed. You should probably check in about it. But you can
That ANOC letter will tell you.
Okay. Yep. Exactly. So watch.
But you already threw that away.
Yeah, exactly. Hopefully people are paying attention to that one. So
Okay.
once again, thank you, Ron. Thank you to everyone who's watching this live. Thank you for participating. Thank you to everyone who's watching this in the future, because most people do watch the replay of this. So thank you guys for watching the replay. And between Ron and I, there'll be another video with Ron probably up here, like one of the original videos about why Medicare Advantage, and then some other videos down. I hate this down here about other expats who've moved to Mexico. If you haven't done it yet, you can get some inspiration there. So we'll see you in another video. Hasta luego.